Measles was declared eliminated in the United States years ago. So why is it suddenly making headlines again? Are vaccines failing? Is this about immigration? Or is social media misinformation playing a bigger role than we think? In today's video, we're separating facts from myths. No politics, no fear-mongering, just real science and what it actually means for you and your family in 2026. And before we dive in, if you care about evidence-based health updates that protect your family and keep you ahead of rising health risks in America, make sure you subscribe to The Health Reason and turn on notifications, because what you don't know can hurt you. Number 1. What is really happening? When most Americans hear the word measles, they think of something from the past, something from black and white photos, something their grandparents worried about. But here's the uncomfortable truth. Measles never disappeared from the planet. It only stopped spreading continuously inside the United States. In 2000, measles was declared eliminated in the U.S. That milestone was achieved because vaccination rates were high, public health systems were coordinated, and community immunity was strong. According to the Centers for Disease Control and Prevention, elimination does not mean 0 cases. It means no ongoing domestic transmission for 12 months or more. So how does something eliminated come back? It starts quietly. An unvaccinated traveler visits a country where measles is still circulating. They return home before symptoms appear. Measles has an incubation period of about 7 to 14 days. During that time, the virus multiplies silently. Then comes a fever, a cough, red eyes. At this point, the person may already have exposed dozens of others. Measles is not just contagious, it's explosively contagious. Epidemiologists measure this using something called the R0 value. Measles has a RO between 12 and 18. That means one infected person can spread it to 18 susceptible individuals in a non-immune population. For comparison, seasonal flu has a R0 of around 1-2. That's the difference between a spark and a wildfire. Now here's the key issue in 2026: herd immunity gaps. Herd immunity for measles requires about 95% vaccination coverage. Not 80%, not 85%, 95%. Why so high? Because measles spreads through the air and lingers in enclosed spaces for up to 2 hours. You don't need direct contact. You don't need to shake hands. You can enter a room after someone has left and still get infected. When vaccination coverage dips below 95% in certain communities and not nationwide, but locally, outbreaks become possible. This is exactly what public health officials are observing. Localized clusters of lower vaccination rates. Schools, faith communities, tight-knit neighborhoods. And once measles finds a cluster, it spreads rapidly. But here's what's important for your audience. This is not a nationwide collapse. It is a targeted vulnerability, and vulnerability is all measles needs. Now that we understand what's happening structurally, let's address what's happening psychologically. The myths. Number 2, myths versus facts. Whenever a disease reemerges, 2 things spread: the virus and misinformation. Let's separate them carefully. Myth number 1. Measles isn't serious anymore. This belief often comes from older generations who remember having measles as children and recovering. Fact. Measles is not just a rash and fever. About 1 in 5 unvaccinated people in the U.S. who get measles are hospitalized. Complications include pneumonia, the most common cause of measles-related death in children, encephalitis, brain swelling, and a rare but fatal condition called subacute sclerosing panencephalitis, SSPE, which can appear years after infection. Measles also causes immune amnesia. It can weaken the immune system's memory, making individuals more vulnerable to other infections for months. This isn't a harmless childhood rite of passage. It's a systemic viral attack. Myth number 2. The MMR vaccine doesn't work anymore. Fact. 2 doses of the MMR vaccine are approximately 97% effective at preventing measles. Breakthrough cases can happen. No vaccine is 100%. But vaccinated individuals typically experience much milder illness and are less likely to spread the virus widely. Outbreaks almost always begin in under-vaccinated communities. If the vaccine weren't working, we would see widespread national transmission, and we are not. Myth number 3, natural immunity is stronger. Fact. Yes, infection produces immunity, but at what cost? Natural immunity requires surviving the disease first. And with measles, survival is not guaranteed without complications. Vaccination provides immune protection without exposing the body to severe risks. Immunity with safety. Myth number 4. This is happening because something changed in the vaccine. Fact. The vaccine formula has not suddenly failed. What has changed is vaccination behavior in certain communities. Viruses don't adapt to politics. They adapt to opportunity, and opportunity appears when immunity drops. Now that we've cleared the confusion, let's talk about the real driver behind declining vaccination rates. Number 3, why are vaccination rates dropping? This part is more complex than headlines suggest. After COVID-19, public trust in institutions shifted. Some Americans began questioning public health recommendations more aggressively. Social media algorithms amplified emotionally charged content, and vaccine-related content performs extremely well. Online fear spreads faster than nuance. At the same time, pandemic disruptions caused missed routine pediatric appointments. Some families postponed vaccines during lockdowns. Others relocated. Some simply fell behind schedule. Many caught up, some did not. In tight-knit communities, where philosophical or religious exemptions are more common, vaccination rates dropped below herd immunity thresholds. It's important to clarify something for your audience. Nationally, overall vaccination rates remain relatively high. But measles does not require nationwide vulnerability. It requires clusters. Imagine a dry forest. The entire country doesn't have to be dry, just one region. When measles is imported through travel, and global travel has fully rebounded in 2026, those clusters become ignition points. This isn't about blaming parents. Most parents want what's best for their children. But when misinformation mixes with delayed care and reduced trust, small immunity gaps emerge, and measles exploits gaps with mathematical precision. Understanding this helps remove panic and replace it with clarity. Now let's talk about what families should actually watch for. Number 4, symptoms people should not ignore. Measles doesn't announce itself dramatically. It starts quietly. Day 1, 3, high fever, often over 104-degree, fatigue, cough, runny nose, red, watery eyes. At this stage, many parents assume flu or a bad cold. Then tiny white spots may appear inside the mouth, called Koplik spots. These are classic but often missed. A few days later, the rash begins at the hairline and spreads downward across the body. By this point, the person has likely already been contagious for several days. Here's something many Americans don't realize. Measles suppresses the immune system. After infection, children can be more susceptible to other illnesses for weeks or months. That's why pediatricians take measles seriously. If someone suspects measles, they should call ahead before visiting a clinic. Walking into a waiting room unannounced can expose infants and immunocompromised patients. Containment matters. Speed matters. Awareness matters. And finally, let's talk about who faces the highest risk. Number 5, who is most at risk? For fully vaccinated adults, measles risk is extremely low. But certain groups remain vulnerable. Infants under 12 months, too young for full vaccination. Pregnant women. Individuals undergoing chemotherapy. People with immune disorders. Unvaccinated children. Infants rely entirely on community immunity. They cannot protect themselves. That's why herd immunity is not just a concept. It's a shield for the most vulnerable. When vaccination rates stay above 95%, outbreaks struggle to sustain transmission. When they fall below that threshold in clusters, outbreaks gain momentum. This is not about fear. It's about responsibility layered across a population. And here's the hopeful part. Measles is preventable, entirely preventable. The infrastructure exists. The vaccine exists. The data exists. The only variable is participation. Note: measles coming back isn't about fear, it's about awareness. The good news? This is preventable. The bad news? Prevention only works if people participate. If this video helped you separate facts from myths, subscribe to The Health Reason for weekly evidence-based health updates focused on U.S. audiences, because smart health decisions start with accurate information.